Thank you for inviting me here today. And I think while the audience is still to come in, I'm just glad that it's a very relevant audience, and these are all informed. It's an informed audience also. And I'd like to state here that, and this is something which is known to all of us. Public health, by its very nature, it's complex. It's intersecting with socioeconomic, behavioral, and systemic challenges. Technology, and especially AI, in this realm, it must be seen as an enabler. I think this is something that we all here in this hall would firmly believe. And especially in resource-constrained settings such as India, doubly so. So whether it's AI-powered disease surveillance, predictive analytics, AI-assisted diagnostics, clinical decision support system, and even drug discovery acceleration, I think the potential is immense. Before I go on to kind of, talk to you all about one particular case study, it's about our decade-long experience, especially in the field of oral cancer. I thought I could play a short video which kind of encapsulates what we are doing in certain tribal settings. We have collaborated with the Institute for Public Health in Chamarajnagar, and in such a remote setting, we have been able to bear on technology. We've been able to leverage on technology to provide last mile healthcare access, but at the same time, there still remain challenges. But I hope that this would provide a setting from wherein I would then go on to talk to you all about our oral cancer application primarily. Thank you. If you could play the video, yeah. A bit about Biocon Foundation, because this video would be showing one of the funding entities, which is Syngene. Biocon Foundation is the CSR arm for the Biocon group of companies. This comprises Biocon, Biocon Biologics, Syngene, Syngene Scientific Solutions Limited, as well as Biocon Pharmacy Limited. So together, we are the vehicle through which the CSR is being done on field.
ಆರೋಗ್ಯವೇ ಭಾಗ್ಯ ಅಂತೇಳಿ ನಮಗೆ ಒಂದು ಗಾದೆ ಇದೆ. ಅದು ನಮ್ಮವರು ಹೇಳ್ತಾ ಇದ್ದಾರೆ ಅವಾಗ. ಅದು ಆರೋಗ್ಯ ಚೆನ್ನಾಗಿದ್ದರೆ ನಾವು ಚೆನ್ನಾಗಿರ್ಬೋದು. ಇನ್ನು ನಾವು 4 ವರ್ಷ ನಾವು ಬದುಕಬಹುದು. ನಾವು ಕೂಲಿ ಕಂಬಳ ಮಾಡ್ಬೋದು, ತಿನ್ಬೋದು, ಎಲ್ಲ ಚೆನ್ನಾಗಿರ್ಬೋದು.
Every day on Syngene campuses, thousands of scientists use the power of science to improve lives for people, patients, and animals all around the world. Using the latest technology, they work on research, development, and manufacturing projects for clients across industries. But that's not all we do. We also support the communities in which we live and work through corporate social responsibility programs delivered by the Biocon Foundation. Our programs focuses on 4 areas: community health, science education, protection of the environment, and the safety of women and children. Our flagship program is running the Ilaj clinics. The Ilaj clinics are fully digitized to ensure all medical records are up to date and easily available. This focus on electronic medical records helps to deliver better treatment and monitor clinical outcomes. But it's not just about the technology. The last mile healthcare delivery model works through proactive community outreach and collaboration with government, grassroots NGOs, and the wider community.
ನಾನು ಹುಟ್ಟಿದ್ದು ಬೆಳೆದಿದ್ದೆಲ್ಲ ಇಲ್ಲೇ ಕಾಡ್ ಮಧ್ಯದಲ್ಲಿ ನಮ್ಮ ಜನಗಳಿರೋದು. ಅಲ್ಲಿ ನಾವು ರೋಡ್ಗಳಿರಲ್ಲ, ಮಣ್ ರೋಡ್ ಇರ್ತವೆ, ಅಲ್ಲಿ ಬದಿ ಇರುತ್ತೆ. ಒಬ್ಬೊಬ್ರು ಮನೆ ಇಲ್ಲಿದ್ರೆ ಇನ್ನೊಬ್ರು ಮನೆ ಅಲ್ಲಿನೂ ಇರುತ್ತೆ. ನಾವು ನಡ್ಕೊಂಡು ಹೋಗಿ ಅವ್ರಿಗೆ ಟ್ರೀಟ್ಮೆಂಟು ಮಾಡ್ತೀವಿ, ಸ್ಕ್ರೀನಿಂಗ್ ಮಾಡ್ತೀವಿ. ಇಷ್ಟೆಲ್ಲ ಕಷ್ಟ ಇದ್ರೂ ನಾವು ನಮ್ಮ ಸಮುದಾಯ ಜನಗಳಿಗೆ ಒಳ್ಳೆ ಆರೋಗ್ಯ ಸಿಗಲಿ ಅಂತ ನಾವು ಮನಸಾರೆ ನಾವು ಕೆಲಸ ಮಾಡ್ತಾ ಇದ್ದೀವಿ.
ಅಲ್ಲಿಂದ ಬಂದಿವಿ IPH ಸಂಸ್ಥೆಯಿಂದ. ಈಗ ನಾವು ನಿಮಗೆ ಬಂದು ಏನಾದ್ರು ಹುಷಾರಿಲ್ಲ ಅಂದರೆ ಕಾಯಿಲೆ BP ಶುಗರ್ ಆ ರೀತಿ ಟೆಸ್ಟ್ ಮಾಡಿರ್ತೀವಿ, ಬಾಯ್ದು ಎಲ್ಲ.
ಆರೋಗ್ಯ ತಪಾಸಣೆಗೆ ಬಂದು ನಿಮ್ಗೆ ಏನ್ ಕಾಯಿಲೆ ಇದೆ ಹಾಗಂತ ಕೇಳ್ತಾರೆ ಸರ್. ಆಗ ಈ ತರ ನಮಗೆ ರಕ್ತ ಟೆಸ್ಟ್ ಮಾಡಿ, ಆಮೇಲೆ ಶುಗರ್ ಟೆಸ್ಟ್ ಮಾಡಿ, ಆಮೇಲೆ ಎದೆ ಬಡಿತದ್ದು ಟೆಸ್ಟ್ ಮಾಡಿ, ಆಮೇಲೆ ಅಸ್ತಮ ಇದೆ ಸರ್, ಅಸ್ತಮದ್ದು ಟೆಸ್ಟ್ ಮಾಡಿ ಅವಾಗಲೇ ಅಲ್ಲೇ ಹೇಳ್ತಾರೆ ಸರ್ ಯಾರಿಗೆ ಎಷ್ಟಿದೆ, ಏನಿದೆ, ಎಲ್ಲ ಕಡಿಮೆ ಇದೆ, ಜಾಸ್ತಿ ಇದೆ ಅನ್ನೋದನ್ನ ಹೇಳಿ ಅದೇ ಸ್ಥಳದಲ್ಲೇ ಹೇಳ್ಕೊಡ್ತಾರೆ ಸರ್. ಅದರಿಂದ ನಮಗೆ ತುಂಬಾ ಅನುಕೂಲ ಸರ್.
These partnerships support remote and tribal community health. This way, we manage chronic conditions while educating communities about non-communicable diseases, helping them avoid the personal impact and long-term economic burden that these conditions represent.
ಇಲ್ಲಿ ಸಮಸ್ಯೆ ಕಂಡು ಬಂದವ್ರಿಗೆ ನಾವು ಇಲಾಜ್ ಕ್ಲಿನಿಕ್ ಕಳಿಸ್ತೀವಿ. ಅಲ್ಲಿ ಇವಾಗ ಮೊದಲಾದ್ರೆ ಬರಿತಾ ಇದ್ರು, ಇವಾಗ ಮೊಬೈಲ್ ಟೆಕ್ನಾಲಜಿಯಿಂದ ಅವ್ರಿಗೆ ಸರಿಯಾದ ಟೈಮಲ್ಲಿ ಸರಿಯಾಗಿ ಚಿಕಿತ್ಸೆ ಆಗ್ತಾ ಇದೆ.
ಫಸ್ಟ್ ಮೈಲ್ ಅವ್ರು ಬಂದು ಇಲ್ಲಿ ಚೆಕಪ್ ಮಾಡಿ ನಮ್ಮ ಆರೋಗ್ಯ, ನಮ್ಮ ಜನರ ಆರೋಗ್ಯದ ಬಗ್ಗೆ ಮತ್ತು ಜನರ ಒಂದು ಒಳ್ಳೆ ಥರದಲ್ಲೆಲ್ಲ ಮಾಡ್ತಾ ಇದ್ದಾರೆ.
Working together with the Biocon Foundation, NGOs and many other stakeholders, including the communities themselves, Syngene is committed to making a difference over the long term as our company grows.
Thank you. I just thought, I'd play this video because, we had created it to show how we're kind of leveraging on technology in especially field settings, and this is Biocon Foundation was established in 2004. So it's a lot of work, which has been accomplished, especially in terms of primary healthcare and then especially also oral healthcare. Oral healthcare is one of our flagship programs, and as you might have seen in the video, the field worker there, she had taken the mobile to the field setting and she was taking an image of oral lesion. If there is a suspected lesion, they take an image. So this, I just thought, I'd leave you with this image and then talk about the program and, how we've incrementally adopted both technology as well as AI into our programs. So this is something that I wanted to discuss. So as you all know, in terms of oral cancer accounts for approximately 5% of all the cancers globally. India has the largest number of oral cancer cases and 1/3 of the total burden of oral cancer. Sorry? You can't hear me? It's okay. I think I need to just speak up a little. Yeah. So, as I was mentioning, oral cancer accounts for almost 5%, of all the cancers globally. Not a very high percentage, but if you have to look at India, it is 1/3 of the burden is actually borne by India. And as compared to West, I think what is really troubling is that in oral cancer, a very significant number, which is 70% of the cases actually present at an advanced stage, which is either stage 3 or stage 4. This actually increases morbidity, mortality, and of course, higher out-of-pocket expenses. And so when we tried, this situation existed even a decade back. And when we thought that, we would engage, understand, what we could do in this space, in terms of addressing oral cancer need, we tied up with KLE Institute, KLE Dental Sciences. And, from there on, our journey began. So we did a deep dive. There was a need assessment which was done in our area. And what we found was that the healthcare workers, which is ASHA workers, were not well trained. They did not have an idea as to what oral lesions would look like. This was 10 years back. So obviously, there was not much of training, neither the medical officers. The entire focus, in fact, was on RMNCH. And therefore, we felt that in this space, especially in terms of early detection of oral cancer, there was definitely a vacuum. And we wanted to, we've also depended obviously upon, secondary data which said that, the burden of oral cancer in Karnataka also was pretty high, again, associated with the use of tobacco, smokeless and smoking. So we felt that the role of the healthcare workers here, that was, very crucial. We needed to train them, capacity building, but also leveraging on technology. And at the same time, we knew that we needed an institutional partner, which is where KLE came in. So over a period of time, we developed research arms with KLE, as one of the institutional partners. What we did is we rolled out capacity building. We rolled out a mobile health application. The mobile health application was more epidemiological in the sense it captured both demographic data, it carried, their history, and so it came out with a kind of risk assessment of the patient. At the same time, because we had a mobile in place, it was able to take images, of the lesion. And these images were then sent to a remote specialist. So KLE had, folks who were from the oral medicine department. The images were sent to them along with de-identified data sets, which was actually the risk factors associated with that particular patient. And so a combination of data went to the specialist. They were able to annotate and tell us whether it was a binary classification, essentially either suspicious or non-suspicious or benign. This data would then come back to the healthcare worker. And so the healthcare worker had actual evidence, that yes, this could be a suspicious lesion. And then on, actually the work began. So many of us, screening is seen as a full-time activity. But for us, I think we went beyond screening to actually understand if we could do a little more a deep dive and actually see if we can do a risk mapping, identify the cohort of patients, see that they are then referred out. And I think the best case scenario is where we are able to enable biopsies. Now, if you have to see our cohort, because we've been doing this since a decade, we have around 95,000 plus screened through our program. I would say hardly 0.1 to 0.3% of the patients have agreed to a biopsy. So I also wanted to, state here that technology can also take you this far, but there are certain challenges which will still remain. In fact, I want to talk about some of the other barriers of technology apart from oral cancer. If you have to see in such settings, in remote settings, in tribal areas, we found that people have a cultural mistrust of technology. It was very difficult for us to convince them to even, do a visual examination of their, an oral visual examination. Apart from that, the women, because of the heavy jewelry, we weren't able to do ECGs properly. So these are some of the challenges we've worked around, but I think what has really helped in pushing technology in these locations, in all, we have locations right from Nagaland to, there is a tribal district in Nashik, we are doing it in Varanasi. There are, it's a heterogeneous group that we are currently, surveilling. And throughout these things, it is one thing that has worked well is the constant engagement of the healthcare workers. Definitely the healthcare workers on ground, and having a trust with the community, that has helped make the technology work. So for us, even in the oral cancer program, while technology has taken us this far, I think the role of the healthcare worker building a community, a very strong community outreach, is very integral to the program. Now, in terms of the mobile health application that we've had, I'd like to tell you that what's happened is because we now had so many images that we had taken from the, from patients across so many heterogeneous cohorts, we had a bank of almost 40,000 images. These images were shared with Indian Institute of Science. And Indian Institute of Science then came up with an AI layer. They are going to be releasing an application which is called Arogya Arohan. It will incorporate, the AI over a kind of classification, and this will become a public good. So in terms of a program which was supported through CSR over a decade, finally I feel technology has had a policy implication. We will be able to downstage, and actually act upon early detection of oral cancer through tech and AI. But at the same time, I would like all those who are tech entrepreneurs here also to be aware of the fact that tech again has to be contextual, it has to be rooted in the community, and it's your frontline, your folks in the field who are going to take it forward. So especially from a public healthcare perspective. So I'd like to end on this note. Thank you so much for kind of giving me this time and opportunity to speak today. Thanks.
Thank you, Dr. Anupama Shetty. Ma'am, please wait on stage. We have a token of gratitude for you. I would like to invite Mr. Praveen Gaudu, Charter Member of TAI Bangalore, to give away the token of gratitude. Thank you, Mr. Praveen.